Maybe standing up. Like I said, if it's a person about my height, I will do it as standing up. If that is a person who is taller than me, I will have them seated. So I can really check the range of motion. So I will ask Leo, you notice that he has his hands on his pocket, and some of you had it and were standing like this, and you were doing flexion or extension or whatever. So ask them to stand up straight, take their hands out of their pockets. So, Leo, what you're going to do is just tap your chin, turn your chest, and just look down, Lord. All right, bring it back up. Anything with that. All right, from right there, I want you to take your nose up the ceiling. Or you can say look up the ceiling, whatever you want. All right, bring it back down. Anything with that. All right? Notice that I was standing on the side to see the screen. Now, Leo, could you please take this ear to the same shoulder? Try not to do any rotation. Just try to get your ear to your shoulder. All right, bring it back up and do it to the other side. All right, back to neutral. Anything with that?
There was pain when I went this way.
Okay.
There was pain here when I went this way.
All right, what type of pain?
Kind of dull.
All right, well, in any case, what does stomach tell you? Probably muscle. All right, so I would like you to do rotation. So you're going to take your nose and turn your head to one side. So try not to deviate or do any other movements, all right? So go ahead and take your head to this side. Bring it back up. Go to the other side. And back to neutral. Any pain with that?
No, just like a stretch.
Just a stretch. All right. Right after that, since he mentioned some pain and had some restrictions, I would like to go in and go ahead and do passive range of motion. So go ahead and face up on the table. All right. So don't do anything. Let me do all the work and stop you feeling pain. All right. Flexion. Take it all the way to the end. Challenge the end field. Anything with that. That was flexion. Okay. NPO, that would be the t-shirt stretch top. All of them are the same. Anything with that. All right.
Can you do that one again?
Yes. Forearm, so I'm doing this.
So you're not pushing up with your forearm at all?
Yes, I am. I'm going opposite direction.
Okay.
I'm extending, and then I'm challenging the end field. So I'm doing this on the
So
table.
what I'm asking, because you go to the end range.
On extension, you can. It will be very uncomfortable for the client and dangerous, that the way they do it, some kind of practice, is they hang the person's neck off the table. That's very dangerous. There's a lot going on, nerves and blood vessels in the back of your neck.
You're on candid camera.
It's possible that the person may faint. So this is a little bit more safe. Lateral flexion. Take the person's ear towards the shoulder. One hand here, the other one there. I'm pushing and challenging the end field with my right. All right? Any pain with that?
Yes.
Where?
Right here.
Okay. What kind of pain?
Still a little achy.
All right. Ooh. Did it hurt?
No.
All right. Any pain with that?
Not as much as this side. It was very little.
Okay. Rotation. Notice how I'm going to take his head up. You notice that? So I'm not doing this. All right? So there you go. I'm leaving my hand on the bottom. I'm not putting my hand here. I'm putting it there. Anything with that?
No.
Anything with that?
Yeah.
Where?
Right here.
All right? Same going I keep. All right. I will continue with manual resistance testing.
So Marsha, just really super quick. So we do that active range of motion, and if they feel any pain in any part of active range of motion, we do the passive range of motion.
Correct.
If they feel any pain in passive range of motion, then we go on
To manual resistance.
If they don't feel any pain during passive, then we stop.
I will continue with manual resistance only because during active, you are testing both contractile and non-contractile. If they did not feel pain during passive, we took non-contractile out of the way, but we still have the contractile tissue. So we need to test for strength or pain on manual resisted. Also, if they didn't feel any pain during active, but they have restrictions, you still need to do passive and manual resisted.
What if everything was good? Like, they didn't
No pain and no restrictions, you don't need to do anything else. So, Leo, we are going to do these together. So what you're going to do, I'm going to show you what to do, the same options that we've been doing. I'm going to apply some pressure. I'm going to give you some resistance. You're going to match it. Do not explode into the movement. So the first one was if you going like this, but I'm going to give you some resistance. So please match it. 3, 2, 1, and relax. Of course, I told you you can do 25, 50, 75 if that's comfortable for you. Or you can just increase a little bit more and a bit more, whichever you like. Extension. You're going to take your neck light up, all right? And you're going to put pressure on my fingertips. Ready? 3, 2, 1, and relax. Any pain with that? And with flexion? Check for that. All right, now, you're going to take your head going this way, all right? So I'm going to prevent you from doing that, from going farther. Notice that I'm initiating the movement forehand. A lot of you did this going to the other side. This is the same side. You can also put your hand on the shoulder in case that they're trying to do one of these. So go ahead and match my resistance. 3, 2, 1, and relax. We take the same thing, we do the same motion towards the other side. So go ahead and match it. 3, 2, 1, and relax. Now, rotation. We're going to go like this. Because my resistance just going a little bit harder and harder in every attempt. Ready?
Okay.
Go ahead and match it. 3, 2, 1, and relax. Same thing to the other side. Go ahead. 3, 2, 1, and relax. That's it. All right? So notice the communication. You need to practice it with both of you, with your partner, and you already know what you're doing. So you just go ahead and do it. But pretend that the person working with you as your client doesn't know anything about it. So you said, could you please do flexion? Yeah, you guys know what flexion is. But hopefully, but then the person may go, I don't know, here. You know, a client out there, they may say, I don't know. And it's amazing. People don't know what flexion of the neck is. They may say it's this, and you say it's that, or this. So you need to show them what to do. Another thing that I noticed is that some of you say, I'm going to run some tests on you. Remember, don't tell them anything about testing. Just run them into some exercises or ranges of motion to help them better. You need manual resistance, now it's special testing to see what's going on with Leo. Let's see if we can figure it out. All right. And of course, you tell dull, achy pain on the back. What test would you run on Leo?
Sterling.
It's Sterling, probably, right? Let's keep it down. All right. So I'm going to have him facing that way. So if he felt pain right here, and it was dull and achy, of course I'm not going to run TOS special testing. He didn't mention numbness and tingling on these 2 fingers. He didn't say, my neck hurts and radiates pain here, and sometimes on the top of the shoulder to run a scaling strength test. So the one that will be better to rule in, rule out DVD or space-occupied lesion or passage joint irritation will be the Sterling. Yes? Agree? All right. So, sit up straight, please. That's another thing that I saw in some of you. Just let the client sit like that. So, make sure that it's straight. All right. First in neutral. Compression. Any pain with that? He felt the pain on this side. So, let's do it on this side. I don't want to waste time. Sorry, deal. Again, my hand will go down, just like this. Any pain with that? Notice that I didn't put him into much lateral flexion, and then I'm going to do extension. Right on top, any pain with that?
A little discomfort.
A little bit of discomfort. Maybe something going on the disc, we don't know. Let's do distraction. Put your hands up. put your hand on the occiput, the other one on the forehead, and just lift it up. Hold it there for a few seconds. How does it feel? Normal. All right. So maybe a little bit. All right. Skin cramp test. Let's say that I want to see a test to rule out this condition. Maybe it's skin cramp test. Maybe he's using these scalings too much, and now these are overcompensating. All right, Leo, I would like you to please look at, pretend you have a pocket right here. So you're going to go ahead and tuck your chin to your clavicle right there and hold it there for a few seconds. So you can count 10, 9, 8, whatever you like, and just hold it there for a few seconds. We're not asking them to breathe on this one. So go ahead and relax. Any pain with that? Any discomfort?
Is it 20 seconds or?
It could be 20 seconds, like I said, 10, 20 seconds. I don't like to count down. 20 seconds is like eternity. So you can do 8, 7, 6, 5, 4, 3, 2, 1. If the person's having any problems with that, I'm telling you, if I do that, within 5 seconds, I'm cramping. So the person will have pain on the lateral neck. They will say that they have pain radiated all over here, in front of the chest, around the scapula, and maybe down the arm, but it's no numbness, no tingling involved.
Are they going to ask us about the 20 seconds? They want the 20 seconds when we do the actual test?
No. So then again, the Sperling was for SOL or facet joint irritation, correct?
Yes.
Sharp local pain, that will be facet joint irritation. Numbness, tingling down the arm, that will be SOL. All right? Skin cramp test, again, low achy pain around here. TOS, you already know that it's a compression of the brachial plexus by the anterior middle scalene, pec minor, of the or the clavicle against the first rib, and subclavian spinning fold. Signs and symptoms for TOS, numbness, tingling in these two fingers, or SF digits. The person may have cold hands, or may say that they feel that their hand is kind of full, like it's swollen. Maybe it is, maybe not. So, absence test. Take the pose of the person. All right, Leo, could you please turn your head towards me? You can ask them to hold their breath, and again, that's the part I do not like, but you can also do it. So, he's just breathing. You will get a quick response if you ask them to hold their breath. I don't, so I hold it there a little bit longer with the pose. Pose did not diminish. Let's say that he says, now I feel numbness and tingling. Would that be positive?
Yes.
All right. So that's it. So he's now positive. You feel numbness, tingling. Okay. So we're going to do the same thing. And again, this is for anterior scaling involvement. Absence test. Posted maneuver. Find the pose again. Now ask the client to turn the other way. So go ahead, Leo. And we're looking for the same signs and symptoms, the same positives. But now middle scaling is involved. All right, go back to normal. Any changes? No. All right. The other one, right hyper abduction. Same thing. Take the pose first. Found it? Make sure that you take the arm into abduction and hyper abducted. Notice that I'm holding the scapula right here, and the pulse went away right away. So numbness, tingling? Positive. So he got a double whammy. So he got a nerve compression, and he also has some vessel compression, so artery and vein.
Which muscle is this directly testing?
I'm sorry?
Which muscles?
Pec minor. That will be for pec minor. Shake it, shake it. All right. Now, costoclavicular. We have a brace. Yeah, the person sit up straight, like almost to the halfway. All right. So find a pose on both sides. There you go. All right. I'm going to take his arms a little bit into extension. Leo, I want you to tap your chin to your chest and slump over a little bit. There you go. You stay. Any numbness and tingling?
On this side.
On the side. He lost pulse on both sides. But he has only numbness and tingling on this side. Is he positive on both?
Yes.
Yes.
No.
On both sides?
Yes.
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 Yes. So if the person has non-stimulating only, positive. If the pulse diminished or went away, positive. If he has both, non-stimulating and diminished pain and diminished pulse, positive too.
Does that mean that one side's more severe than the other?
Yes. In this one, he has the everything compressed,
Right.
plexus and the subclavian vein and artery. On the other side is non-nerve pain.
So what would you do to work on him? You would.
Pec minor. I mean, subclavian. And of course, pec minor.
So you would go in there and palpate and move that area.
Yeah.
Okay.
Mm-hmm. And that's good. Yes, sir.
So we got pec minor, subclavius, what else?
Anterior scaling, that will be absent. Middle scaling, that will be Holster maneuver. Subclavius, clavicle against first rep for military brace. Hyper-A deduction, that will be pec minor.
Right.
All right? Cramp test, scaling cramp test, that's a scaling. It's Sterling, that will be working on all the muscles on the anterior lateral neck to help release the hypertonicity. And of course, the person will be going like this, like going away from the pain sometimes. So that would be, it's mainly trigger point. But with the Sterling, you want to do, let's say the person has a degenerated disc disease, SOL, or facet joint irritation, lots of tractions during the treatment. The rest will be pretty much trigger point work and smoothing out and lengthening those muscles. And that's pretty much. I'm sorry?
Unless they have fusions in them.
Correct. So if they have fusions, if the person has a laminectomy, they took the lamina group out, or they have rheumatoid arthritis, we're not going to do tractions. Mm-hmm. Cool? Any questions on this? Anything at all that you need to see once again? Yes.
Well, okay, so just so I know, on the Sterling test, we're testing all the anterior lateral muscles of the neck.
We are testing for the space-occupying lesion when the disc is coming out of the vertebrae, and we are testing for that or facet joint irritation where the facets are joining together and frictioning with each other. That's the main thing we're testing for. However, because of that, the muscles are going to be compromised. But that's not the condition. The muscles have nothing to do with that condition. It's the other way around. Because that condition, the muscles are compromised. Right? So I want you to please start having your 3x5 cards. I want you to go home this weekend and start writing down the name of the test, the signs and symptoms, the conditions, and the positives for it. Start creating a booklet for yourself, like a little note that you can easily use during the train or during waiting to get in line to go and see a concert or whatever. So just have it with you all the time. I use that a lot. I have to work double. As you can see, English is not my first language, so I have to do double. So I have to learn and relearn, and for anatomy and physiology just to be a little bit different from what it is right now. So we used to have only anatomy, physiology, pathology, and that was learning another language for me. So probably you get a very great advantage. This is your first language. But, it doesn't mean you don't need to work hard. But please, if I did it, you can do it too. So those 3x5 cards, they're very helpful. They're very helpful.
Could you repeat what should be on them again?
Yes.
Name of test.
Name of the test, signs and symptoms, the condition, and the positive. Now, these are cards that you have, Kate, so that's very helpful too for the muscles. So if you have them, that would be excellent. You can take them everywhere. Mine are almost ripped, all of that. I took them everywhere. Same thing with your clinical integration. Take those everywhere with you. That would be very helpful. And again, do hands-on. Do not just memorize things. Do it. Practice hands-on. Okay? All right. So we're done with your math testing. This is the end of this class, basically. Next week you will have a quick review, hopefully, by Amber, and you will have the case studies to work on. Right after that, you will have your test, and then again your quiz. So it's very little information for this much time, and I was expecting you to have hundreds in all your tests. So I hope that test number 3, those will be hundreds for all of you.
Monday.
So that will be Monday. Hopefully no less than 80%.
We might take
Case studies, that would be saying, client number 1 is a 25-year-old male who was playing hockey and he's having headaches. What would be, he's having headaches and he has some radiating pain along the neck and the upper shoulder. He's in Advil. And what kind of questions would you like to ask your client? And then you formulate those questions with that information. What would you do? Active range of motion, passive resisted? What type of a special test? What do you think your client has? What would you do for them? So it's like creating a case study for you. If I come in to you and say, this is what I have, what can you do for me? You know exactly what to do. All right? So that would be the case studies, and there are 3 of them.
So it's kind of like putting your whole treatment plan on paper.
On paper.
Mm-hmm. And I think you will be working in groups.
And that kind of helps you out with your SOAP notes.
Yeah.
Yeah.
All right? Yes, sir.
Okay, so back to the Spurling.
Sure.
But that you use Spurling to test for SOL, DDD, cervical facet, and herniated nucleus.
All right. The SOL, that's the herniated disc.
That's the same thing.
That's the space occupying lesion. That's SOL. That's the same thing. Facet joint irritation, the facets frictioning with each other, is the same thing.
As SOL and
SOL, okay, let's say that SOL is a DDD, or, all right, let's put it this way. SOL is when the disc comes out of the vertebrae, right?
bubble.
Right. So then again, that is compressing on the nerve. So that's a space-occupying lesion. The little bubble shouldn't be there, compressing on the nerve. So that's a space-occupying lesion. That's a degenerative disc disease or herniated disc disease. So it's the same thing. All of them is the same thing under SOL. Facet joint irritation, that would be the facets, the bones frictioning with each other.
Okay.
All right?
DDD and HNP are under SOL, but
Yes.
facet syndrome is
Facet joint
It's
irritation.
just rubbing, bone on bone.
So
Correct.
that has nothing to do
you
with,
got bubbles. That's that friction. Okay.
so the facet joint irritation has nothing to do with pinching the nerve then?
Sometimes it does not.
Sometimes it doesn't.
No, sometimes one starts first, like herniated disc, and then the disc will be just compressing a little bit more down on the, so that the facet above and below start frictioning. So the person may have both at the same time. Maybe a herniated disc plus facet joint irritation. But a person may have no herniation, but only facet joint irritation. So sometimes it's a combination of both, but not always.
So are we supposed to be able to tell exactly
By
which
the
one of
signs
those
and
is
symptoms.
husband?
If I say local sharp pain right there, facet joint. If I tell you numbness, tingling, shooting pain down my arm, maybe it is CDD. And they will say numbness, tingling on the whole hand, or numbness, tingling down the elbow, or it stops right here, but it's electrical shooting pain. So that would be more like a CDD or herniated disc. But local sharp pain, facet joint irritation.
Since they have local sharp pain and radiating.
That's both. Correct. Any other questions? Yes. All right. So dull and achy pain, that would be muscle. Sharp tingling will be nerve. And then sharp and local, that could be bone with bone, or it could be tendonitis. Pins and needles, that would be also nerve. What is it? And burning. Burning will be fascia.
Like stretching?
Yeah, kind of like that. But it's when you guys are reading for a long time and then you feel the burning sensation in the back of your shoulder. That's fascia.
The other day I had when we were doing the chairman stuff, I had burning and it was like my hands would on my nose on fire. And so I asked Leo and she was like, yeah, so it's fascia, and I was spreading out.
Yes. Yes. Burning could also be a combination of fascia, and depends on how the person says, this is what I feel. They may categorize the nerve pain as the burning sensation. Nerve pain is very difficult to really isolate or describe. the person may say, yeah, I feel like shooting pain going down like electricity, or like burning down my calf. So it could be when they say burning, weird pain, that's nerve pain. But when they say it's just burning because I've been like this, or I was sleeping like that and I feel burning sensation here, pretty localized, then that would be fascia. Mm-hmm.
Localized burn can be fascia.
Yeah,
Traveling burn is nerve.
you got it. Yeah. Any other questions? No? What?
Traveling burn is what?
Nerve.
Nerve. Yeah. All right. You're good?
Yeah.
Yes? Yeah.
Sure.
All right.
I got it on, you know,
Okay. So again, I want you to do well, and you seem to have a lot of potential to become one of the best students at Soma. That doesn't come around so often. Right now, I think I have only one group in the last 2 years who is a very decent group. And I want you to be the same because I think you have potential for it. So please start studying. All right? Start studying. I want people from the outside to tell me they know what they're doing. Because I get people from outside when they come to clinic. You get massage therapists, you get alumni, you get people who own their own place, and they're looking for massage therapists. So I got some of them to say, did you teach these people? No, I did not. They were not my students. Just kidding.
That's not a teacher here. I was visiting.
They're usually not my students.
So that's it?
All right.
I can stop?
Yes.